In Chapter 3, we discuss the human body. Obviously, when we're providing first aid, it is very important to understand the different parts of the human body, the systems particularly, and also understanding directional terms. So these things will help us be better first aid responders. So when we think about the human body, it's something that is so complicated. And not only do we need to know the structure and functions of the body, but sometimes understanding some of the medical terms allows you to communicate more effectively with other physicians or medical care providers and whatnot. So the more that you can learn and understand about human anatomy and physiology, the better off you're going to be as a first responder. Of course, you're not going to have the background of a doctor or a medical care professional, but you will have more knowledge than the lay person. There are different types of terms that we use when we refer to the body as far as its direction. So there's the right and left side, there's the anterior, which is the front, posterior is the back, superior is higher up, closer to the head, and inferior is closer to the feet. Lateral is farther from the midpoint of the body, medial is closer to the midline. Proximal is close to where the limb is when it's attached to the body. Distal is the distance from the point of attachment. Superficial can mean just closer to the two or on the skin, and deep is further inside the body. So you want to become familiar with these terms and understand the directional terms that apply to human physiology and anatomy. The quadrants, there are different sections of the abdominal cavity, and you can be, there are four of them. It's the right upper, right left, right lower, left upper, and left lower quadrants. Body systems are very important to understand. The most life-threatening conditions usually affect the respiratory, circulatory, and nervous systems. So that refers to the lungs, heart, brain, and spinal cord. In this particular section of the chapter in this video, we're going to discuss the respiratory system in general. So again, this information is very introductory. It's not getting deep into it. Anatomy and physiology course will do that. So if you do not have oxygen for 4 to 6 minutes, that can result in death. So we need to get oxygen to all the cells in the body, all of the organs, all of the systems, otherwise death will occur. And the way we deliver that oxygen is through the blood. So the respiratory system itself is broken up into the upper airway or upper respiratory and the lower respiratory system. Upper has to do more with the mouth and the nose, and when we think about the lower respiratory system, we're down into the trachea and into the lungs and the diaphragm. Become familiar with these parts because all of them have different functions. Understanding the mechanics of breathing. Respiration and ventilation are two important concepts of breathing. So respiration is moving air in and out of the lungs. So when we inhale, it's breathing in, and when we exhale, it's breathing out. Ventilation is a mechanical process that occurs that increases and decreases the size of the chest cavity. So when we inhale, we're expanding the chest, and when we exhale, we are deflating it. Infants and children have a different mechanics of breathing due to their respiratory structures being smaller. Their airways can get obstructed easier. Their tongues take up more space in the mouth, and they have a more flexible trachea. So these things need to be taken into account when dealing with infants and children. Their physiology, their anatomy is slightly different than adults. When we think of cardiac arrest, most of it is caused by an uncorrected respiratory problem. Remember, we have to get oxygen to every cell of the body in order for the systems and organs to be working properly. Respiratory rates will decrease at rest, obviously increase when we exercise, but it's controlled by the brain. We really don't have autonomic control. It's part of the autonomic nervous system. It's controlled by the brain. We can't stop. Yeah, we can hold our breath for a couple of seconds here or there, but we can't stop. Eventually, the autonomic nervous system will kick in and force you to breathe. So a normal breathing range for adults is about 12 to 20 breaths per minute. Try that, time yourself for a minute and see if you fall within that range. Signs of inadequate breathing, you might be outside that normal range. Or if your skin is cool or clammy, If it's pale or cyanotic, cyanotic means it's starting to turn blue. And if you have nasal flaring, those are signs that you're not breathing properly. So those are things you should look out for. So aside from that, with regard to the respiratory system, that's all we're getting into is in detail, because like I said, in anatomy and physiology courses, you're going to go way into much more detail with regard to how the respiratory system works. But for the purposes of this course, you want to know the basics. Again, this video is just a brief overview. You want to be reading your chapters to be getting more detailed information regarding the various systems in the human body.